Emil Kraepelin had discovered schizophrenia and manic depression. Now, schizophrenia is a psychiatric diagnosis that describes a mental disorder characterized by impairments in the perception or expression of reality, most commonly manifested as auditory hallucinations and paranoid or bizarre delusions, and by significant social or occupational dysfunction. In the DSM-4, schizophrenia is classified as a thought disorder. Eugene Blair coined the term schizophrenia in 1908. Onset of symptoms typically occurs in young adulthood. A diagnosis is based on the patient's self-reported experiences and observed behavior. Schizophrenia, illness features. Now, we've talked about this earlier, but what is the difference again between hallucination and delusions? Okay, so you kind of think about, remember our hallucinations, the things that they see that aren't there. Delusions being things that they might say. And then illusions are that they see things, but they don't perceive it correctly. Now, the most common types of delusions in schizophrenia is persecutory. Now, these negative symptoms we see here are going to be that flattened affect, which is the loss of expressiveness that most schizophrenic people will develop during their illness. Alogia, which they speak very little, brief or often empty phrases. Avolition, as that they lack motivation for work or other goal-directed activities, and hedonia, or a loss of pleasure in daily activities. Schizophrenia, the affected person they might talk to themselves and see things. They feel that people might be out to get them, believe in all sorts of conspiracies, and may even believe that they are God. Schizophrenia, the affected person may also be unable to work, or may even look like they have dementia. They will lose the ability to get and even keep friends. Family support is needed with a patient with schizophrenia. It is important to let the family know that their loved one will benefit with them feeling and appearing in control of themselves. In other words, leading by example. Rehabilitative services definitely include PT and OT, and this is a good example of rehab service. Schizophrenia treatment, biological. Now, the medications, neuroleptic medications, control symptoms of schizophrenia, but you need to watch for side effects like the head turning down to one side, the tongue fixed and protruding, the extraparietal symptoms of the dystonia, which is a neurological movement disorder in which sustained muscle contractions cause twisting and repetitive movements or abnormal postures. The disorder may be inherited or caused by other factors such as birth-related or other physical trauma, infection, or reaction to drugs. Dyskinesia. That's impairment of control over ordinary muscle movement, often resulting in spasmodic movements or tics. Sometimes diabetes accompanies long-term use of these medications. Clozapine is a drug that has been effective than some older traditional neuroleptic drugs, but it has been shown to cause a granulocytosis. This is a marked decrease in the number of granulocytes. And granulocytes are a type of white blood cell filled with microscopic granules that are little sacs containing enzymes that digest microorganisms. Neuroleptic malignant syndrome. This is caused almost exclusively by antipsychotics, including all types of neuroleptic medication. The higher the dose, the more common the occurrence. The first symptom to develop is usually muscular rigidity, followed by high fever and changes in cognitive function. Other symptoms would be unstable blood pressure, confusion, coma, delirium, muscle tremors. Once the symptoms do appear, they rapidly progress and can reach peak intensity in as little as 3 days. And these symptoms can last anywhere from 8 hours to 40 days. Schizophrenia treatment, psychological. Those who have family benefit the most because they're informed about the illness, they have support, and they have the skills to deal with the ill family's members. The family member skills are that they are able to respond to dangerous behavior and they can accept the ill member of their family may never be like they once were. Disordered thoughts. Thought process disorders is a major characteristic of schizophrenia. This includes disordered thoughts, delusions, and hallucinations. It's important to address are those things that, again, are safety issues. Not taking medication and voices are telling them to do something, then an auditory hallucination might be threatening in nature. You might hear it say, kill the baby. Incomprehensible language. Neologisms is a creation of words which only have meaning to the person who uses them. That girl is so shitty. These making up of words is neologisms. Derailment, going off point or subject. Switching mid-sentence or I was going to the laundry, I got a tattoo in Florida. Incomprehensible language, tangentiality, and that's failure to stick to the original point. It replies to questions in an irrelevant manner. My mother's job, she used to sit around the house doing nothing but drinking. I'll never forget that the way my puppy was wrapped in a bow. And then word salad, the speech is not logically connected, especially when individual words might be intact but the speech is incoherent. May I ask you something personal? That cost a man a bunch of money. She's teaching her brother the German language. It's very much a loose association. The ideas do not make sense together, but they do make sense if they were by the individual sentence. Loss of function. Some patients might have catatonia might experience an extreme loss of motor ability or constant hyperactive motor activity. Catatonic patients will sometimes hold a rigid posture resistant to being moved, even bizarre positioning, and will ignore any external stimuli. Patients with catatonic excitement can die of exhaustion if not treated. This has also been known to be treated with electroconvulsive shock therapy. Hallucinations is a sensory perception experience in the absence of an external stimulus as distinct from an illusion, which is a misinterpretation of an external stimulus. Grandiose delusions again, especially in schizophrenia. These are the ones that they believe that they are famous, or they're incredibly wealthy, or very, very powerful. Persecutory again. A common one that patients share is that the FBI or other people or spy institutions are after them. And then referential, that they believe that there are certain public communications that contain specific hidden messages. A patient might believe that a television host's gesture has personal meaning for them. For example, that the song lyrics contain a special personal message. Another thought process differential, we look at the example, is that they feel that the radio can actually see them and record their thoughts. Nursing theory. Be sure to introduce yourself and work on building trust, and that's going to be the most important out of all 5 of these that are listed. Introducing self and build trust, promote positive orientation, promote perceived control, promote strength, or set mutual goals. This is called the 5 aims of intervention that can become the foundation for all work with the schizophrenic patient. Assessment. Initially, you would listen to the delusion to see what the effect the delusion has on the patient's judgment and responses. Then, if they are having auditory hallucinations, it's important to interrupt the patient voices by getting the patient to talk to you. If they tell you that they're out to get me, your therapeutic response that is going to be one that's empathetic is, that sounds frightening, not like you dummy. A negative symptoms of schizophrenia are ones that you might see through here again, that flattened affect, or verbal threats toward neighbors. Nurse and diagnosis. This shows examples of different nurse and diagnosis for the schizophrenic patient. Disturbed thought processes, sensory perception, sleep patterns, self-care deficit, ineffective role performance, social isolation, ineffective therapeutic regimen management. But once symptoms are brought under control, the concerns for loss of function, social isolation, and role performance could be addressed on a rehab plan of care. The priority will always be the physical needs of the patient. Outcome identification. A good goal in providing rehabilitative services to patients is to help them problem solve in everyday social challenges. Suicide is more likely to occur when improvement is noted. Planning and interventions. Since the assessment, plan, and outcomes are all based on alleviating acute symptoms, much of the nursing care will be collaborative and involves use of medications to bring the symptoms under control. Evaluation. Evaluation of nursing care is always based on whether or not the identified outcomes have been met. When the outcomes are written in behavioral and measurable terms, the nurse can readily evaluate if the outcome has been met.